Hello, is it Miss English?
Yes.
Miss English. My name's Jordan. I'm going to be your SRNA taking care of you. We're going to be doing just an assessment today. Is there anything you'd like to go by?
Morgan.
Morgan? Okay. Morgan. We're going to start by asking you some medical questions. Do you have any problems, any kind of medical problems?
No.
Do you have any problems with your teeth? Any caps, dentures, loose or missing teeth?
No.
Any problems with your heart?
No.
No murmurs, CHF, high blood pressure?
No.
Do you have any problems with your lungs?
No.
No asthma, COPD, emphysema?
No.
Do you smoke?
No.
Okay. Do you use a CPAP or a BiPAP at night?
No.
Any problems with your stomach, like acid reflux, hiatal hernias, peptic ulcer disease?
No.
Okay. Any problems with like bones or joints, arthritis, osteoporosis? Any neurological problems, seizures, strokes, TIAs, headaches, migraines?
No.
Any problems, vascular problems?
No.
Okay. Ever had any blood clots or anything like that?
No.
Okay. Let's see. Okay. Do you take any medicines on a regular basis?
No.
Okay. Well, is it okay if we start our assessment?
Yes.
Okay. For the video, since we are videoing, we're going to let you leave your shirt and your clothes on. It's best if you do do an assessment, skin contact with your stethoscope. But for video and purposes, we'll let you leave your shirt on. Okay. So we're going to start by starting at your head, working our way down, then your extremities. We're going to check your cranial nerves. We're going to have you open your mouth, check for dentation, your Mallampati score. We're going to work on down. We're going to check your lymph node, your lymphatic system. Then we're going to check your heart and your lungs. Then we're going to check your peripheries and your extremities. Okay?
Okay.
So we're going to start by checking cranial nerve 3, 4, and 6, which is your eye movement and your pupillary reflexes, okay?
Okay.
So I'm going to get you to follow my finger. Okay. Now there's going to be a light coming in each eye. Just look straight ahead. Pupils good and reactive. Right pupils are reactive. They're equal. Now we're going to start by looking at your nose. Have you ever broken your nose?
No.
Okay. Let's see. It looks symmetrical. Now can you tilt your head up for me? We're going to look in your nose. Okay. You see your turbinates, which is good. Your septum is symmetrical. I don't see any deviation in your septum, which is good. Okay. Can you open your mouth for me? Okay. Can you stick your tongue out? Okay. And your tonsils look good. We can see your soft palate looks good. I give you a Mallampati score of 1. Okay, I'm going to open your mouth one more time. I'm going to check your incisor distance, which is about 6 centimeters. Well, that's good. I'm going to have you lift your head up for me. Look way back. There we go. I'm going to check your thyroid distance. There we go. It's probably about 10 centimeters. Okay, you can let down for me. Okay, and can you clench your teeth together? Clench them real hard? Okay, good deal. Do you have any problems with your jaw, like TMJ?
No.
Anything like that? Okay. Can you take your bottom lip and bite your top lip for me? Cut your bottom and bite your top. There you go. Do like that. Take your bottom and pull it out. Okay. There we go. Okay. Now stick out your tongue for me. And say ah. Okay. Good deal. Tongue symmetrical. Your soft palate rises symmetrically, which is checking for cranial nerves 12 and then 9 and 10. So now we're going to start palpating. So we're going to start right here. Palpate for lymph nodes. These are your pre-auricular, post-auricular, okay, which I don't feel. We'll work our way down. To our subgangular, our submental, and work do our post-cervical, anterior cervical. Go down. That's our supraclavicular lymph nodes, which I don't feel any lymph nodes. Maybe a little bit. Tonsillar lymph nodes, maybe just a little bit. Have you had any sinus drainage?
Just a little bit.
Okay. Now, can you tilt your neck way up for me and touch it down to your chest? And then go side to side. Does that hurt or does that feel bad?
No.
Any pain there?
Mm-mm.
Okay. We're going to check cranial nerve 11. If you will push your shoulders up for me. Okay, good deal. And that's your spinal accessory nerve. And then we're going to push against my hand. Okay. Now we'll push this way. Good deal. That hurt anything?
No.
Good deal. So now we're going to start. We're going to work our way down. We're going to go to your lungs. I'm going to get you to turn just a little bit for me. Okay, there we go. I'm going to palpate your spine. Any tenderness in your spine?
No.
Palpate it. Make sure there's no deformities. Any pain or anything like that?
No.
And we're going to start by working in an organized fashion. Start here, working our way down each side. We're going to avoid your scapula so we can hear. Okay. Deep breath in. Deep breath. Deep breath. Another deep breath. Deep breath. Deep breath. Another deep breath. Deep breath. One more on this side. One more on this side. Good deal. Lungs sound clear. Listen to the front side. You have any deformities or anything that you've noted here on
No.
the front side? Any tenderness?
No.
Deep breath. Deep breath. Deep breath. One more. Good deal. So now we're going to start. Now we're going to kind of move on to your heart. In your history, you didn't say you had any murmurs, anything like that, any kind of heart problems?
Right. No.
No heart problems? So we're going to start by listening to the aortic valve. We'll go over to the pulmonic valve. These are at the second intercostal space. We're going to go down to the third intercostal space, and this is Erb's point. And the fourth intercostal space. That's your tricuspid valve. Then we're going to move over here to your fifth intercostal space, midclavicular line. And that's going to be your mitral valve. Everything sounded good. I didn't hear any murmurs. I'm going to kind of palpate your chest just to look for any thrills or heaves, which I don't feel. There we go. I'm going to check for aortic regurgitation, which I'm just going to have you lean forward. Okay. I'm going to let you exhale all you can and hold your breath. There you go. Now while we have you sitting up, I'm going to kind of move to your extremities. And then once we do that, we'll lay you down and we'll do an inspection of your abdomen, okay? I'm going to get you to squeeze my hands for me as tight as you can. Squeeze. Okay. Don't only pull against me. There we go. Now push. Have you got any weakness or anything?
No.
Let's check your radial pulses. Your cap refill. Looks good. Okay, what I'm going to do, I want you to hold your arms up for me like this. Now turn them over. Close your eyes. I'm going to look for pronation drift, which I don't see any. Don't let me push them down. Good deal. Don't let me push them up. Good deal. There we go. Okay. Keep your eyes closed. Can you feel me touching?
Mm-hmm.
Which arm am I touching?
The left side.
Which arm am I touching?
The right side.
Okay. You want to poke you and tell me if it's sharp or dull.
Sharp. Sharp. Dull. Dull.
We're going to move down to your extremities. You can cross your legs for me. Okay. I have to adjust the camera just a little bit. There we go. Okay, I'll get you to push up with it. Push up. Okay. Pull down. You had any weakness or anything in your legs that you've noticed?
No.
Push like you're pushing on gas pedals. Pull your toes up. Close your eyes for me. Now, which leg am I touching?
The right.
And which leg am I touching now?
The left.
I want you to tell me if it's sharp or dull.
Dull. Sharp. Dull. Sharp.
Check your pedal pulses. They're good. They're not bounding. They're very powerful. Posterior tibial pulse. Good. Okay. That's good. Okay. Now, we're going to take and I'll have you lean back for me.
Okay.
I'll let you lean back. We'll also take your abdomen. Raise your shirt just a little bit. Okay. I don't see any kind of deformities or any pulsations. Active bowel sounds in all 4 quadrants. I'm going to just kind of lightly push on your stomach. Any tenderness when I push?
No.
I'm going to go a little bit deeper. Or if I push deeper?
No. No.
Kind of put my hand here. I'm going to try to see if we can feel your liver. Okay. Take a deep breath in.
Oh.
Deep breath. Okay, there it is. Okay. And then I'm going to percuss. I'm going to have you do one more thing for me.
Okay.
I'm going to get you to roll over on your left side. We're going to check for mitral stenosis. You'll kind of use the bell side of the stethoscope. You'll turn back towards me just a little bit. There we go. Put my stethoscope right here on the apical pulse. Sounds good. And I'm going to have you sit back up for me. We're going to check your reflexes, and we'll have you stand up and kind of see how well you move your range of motion, and then we should be done, okay?
All right.
So we're going to check your bicep tendon first. I'm going to get you to flex your arm up for me. Right there. I'm going to find your tendon. Flex for me. There we go. Perfect. Okay, now just relax down. We don't have a percussion hammer, so we're going to use this. There we go. Let's do the other side. Okay. Flex up for me. There we go. Now just relax. Perfect. We're going to check your triceps tendon. I'm going to have you flex out for me like this. There we go. Find that tendon right there. Now just relax down for me. There we go. And just let it relax. I've got your arm. There we go. Other side. Flex out for me. Find that tendon. Okay. There we go. Now let it relax. There we go. We're going to check your brachioradialis tendon. Should be right there. Relax. Take your watch off. Let's go down just a little bit. We'll check your patellar tendon. Uncross your legs for me. Just let them ankle. Right there below your kneecap. There we go. The other side. We're going to check your, go down just a little bit. We'll check your Achilles tendon. Hold your foot up just like that. Just let it relax in my hand. Okay. There it is. Looks good. Okay, I'm going to have you stand up for me. Okay, can you bend over for me? I'm going to just test your spine while you bend over. Any problems bending over?
No.
Okay, lean back for me. Go back as far as you can. There we go. Range of motion is good. Okay, I'm going to get you to go side to side. Any problems?
No.
That's good. Have you had any problems walking?
No.
Your gait's been good?
Mm-hmm.
Okay. Let's move that up, and we'll try that again. Okay, can you bend over for me? Good deal. Palpate your spine. Okay, stand up. Go back for me. Any problems?
No.
Okay. Go side. Side. Okay, there we go. That's it. Do you have any questions? Everything looked good?
Okay. Thank you.
Hey, so I'm going to have you look up towards the sky. I'm going to palpate your trachea. It's midline. And your cricoid membrane is right there. I'll get you to swallow for me. There we go. I don't feel anything, any masses in your thyroid. I've got one more thing here. You'll turn towards me just a little bit. I'm going to check your CVA, make sure I don't have any tenderness. So I'm going to hold my hand right here, and I'm going to kind of hit it just a little bit, and you let me know if it hurts. Does it hurt?
No pain.
The other side? Okay.
No pain.
Good deal. And that concludes our assessment. I thank you.